So at Texas Children's Hospital, we've always known what it takes to keep you and your family safe and healthy. So realize, before anybody comes into our facilities, they're screened to the best of our ability to make sure that they're safe and healthy. This means all doctors, all nurses, all staff, and all patients and their families. Once they're in our facilities, everybody is required to wear a mask in our care areas. This means the caregivers and the patients and their families. And of course, we're very attuned now to social distancing. We want to respect those rules because we feel they do protect patients from contracting the virus. During this crisis, we feel it's very important to test patients who are undergoing surgery and other procedures for COVID-19. At least 48 hours before the procedure, patients will receive a test, typically in a drive-through facility for their convenience. Assuming those tests are negative, we move forward with the procedure. In the case that patients test positive for this virus, we delay the procedure and retest the patients to ensure that they're negative before they undergo surgeries or these other procedures. If a patient is in our facilities and is ill and is proven to have COVID-19, we have special care areas, isolation, and special procedures that we use to protect the patients and the caregivers here. So when a patient arrives for surgery, we've begun staggering the arrivals to make sure that families are not crowded in waiting rooms. Immediately upon arrival, you're given a mask, and you and your child are placed in special rooms isolated from other families who are also awaiting surgery. During the course of the procedure, we take special precautions, if necessary, using additional personal protective equipment to make sure no one is exposed unnecessarily to COVID-19. Following the procedure, we do everything we can to send the family home as quickly as possible when it's safe to minimize their exposure to people in the facility. So we realize increasingly that families would much rather receive their care from home if at all possible. And we're trying to do that in numerous ways. One is MyChart pre-check-in. All families who are cared for at Texas Children's have access to an electronic record called MyChart. Through MyChart, they can do many things, including check-in before they get here. Additionally, once patients are here and have had a procedure, we do the best we can to set up a post-op visit virtually. That is, through a telemedicine hookup between us and the family, preventing the need to return to the facility. Additionally, using MyChart, families can check their doctor's instructions and notes. They can receive prescriptions and can actually even contact doctors and the care providers to get instructions about questions they may have in the post-operative period.